Abdominal hernias are common, and they're in fact one of the commonest general surgical procedures is to fix up a hernia in the abdominal wall or in the inguinal or femoral regions. As with all hernias, we tend to fix them because they're causing symptoms. So most of the symptoms that people can get from hernias just include an unsightly lump or discomfort or pain when they exercise. One issue for hernias though is when they get larger than about thumb size, there's a yearly risk of a bit of bowel being caught in the hernia, which then becomes strangulated, which then can lead to emergency surgery. So that risk is only about 1% per year. So because hernias are progressive, they always go from small to large over time. You can sort of assume for most people that eventually an operation might be required. But if somebody's got a small hernia and no symptoms, you don't actually know if they're going to need the hernia fixed this year, next year, or in a decade. So the presence of a hernia makes somebody eligible to consider having a surgery, but the person has to decide that they're suitable for surgery. And then that really means a conversation about what the surgery involves with regards to recurrence rate, risks, and outcomes versus what are the outcomes if we leave the hernia untreated. Certainly for most small hernias, leaving them untreated for a while is harmless enough. But once hernias start getting quite large, unfortunately the risks and success of hernia repair gets progressively less. So we generally don't like leaving a lot of people with large hernias untreated, apart from if they're very old, in which case you cross your fingers and hope they don't get a major problem.